you
Yep.
bring up the silo piece, I love, and I want to do a call out to that because
Yeah.
you mentioned, with PFD being such a new diagnosis, really, and the silo piece of it, do you think that that's why so many pediatricians missed it or it wasn't formally recognized for so long? You think that that's kind of the contributing factor?
I think there's a few. I think there's the silo effect in our like our current vernacular of it, which is why that diagnosis, the consensus on a shared definition of a diagnosis was so important and the parameters of it. And I
Hmm.
love it because it's a multidisciplinary diagnosis.
Yeah.
Like imagine if autism had a multidisciplinary diagnosis. Like it's such a neat story to show the impact you can make on families when you work together.
Yeah.
Um, but also like unfortunately, if you think about our educations, like 2019 was what 5 years,
That, but that's
seven, thank
crazy.
you, 7 years ago.
Yeah.
Yeah. And then 2013, like, so both of those diagnoses have been more or less within a decade. And most of us clinicians, like, "Ooh, I'm 42, you know,
Yeah.
so my education was 20 years ago. And so I definitely wasn't educated on this. Many of your pediatricians have no clue. Again, they'll know words like failure to thrive, which has now completely been recoined. Like now we don't even say failure to thrive. We say faltering weight, I think. And even parents even stress about that. So there's all these different terms that we've heard, but again, no shared diagnosis that we can connect to. And now we have that, but now we also have a history of all these clinicians and educators that didn't have that included in their training. So we've all had to do a lot of individual kind of like apprenticeships to
Yeah.
get where we are right now and connecting ourselves through this Feeding Matters, like Pediatric Feeding Alliance, if you will.
Yeah. So then staying connected to
Hmm.
local organizations, communities where you
Yeah.
can continue to be in the know of things
Yeah.
like this. I think that that shows another benefit of staying connected to other professionals is
Hmm.
as we're learning more and new things are coming up, you're able to be right on the cusp of new information so you can support families more effectively,
Yeah,
right?
and really, like, I think for parents, um, it's not their fault. Like, I think it just like the autism diagnosis, we had the cold mother, like, oh, so all those cold
Yeah.
mothers who made kids autistic. Now we have like that was almost like 100 years of an evolution of a diagnosis, and now we're in the neuroaffirming movement, and we're learning more about how we can be more responsive to people and their diagnoses appropriately or
Right.
compassionately. Now PFD is in the infancy of its journey, and so parents are still shamed a ton. Like it's the
Yeah.
parent's fault, or they say, wait and see, you're just being overly stressed. There's a lot of dismissal, unfortunately. And so we're just trying to advocate and push that
Well,
moving
and
forward.
going off of that, I love that you're bringing that up because, one of our core focuses of the podcast is really providing that information to parents. So for someone that is navigating that journey for the first time, they're immediately blaming themselves for
Yeah.
it.
Yeah.
What would you tell a parent? Like, how would you, what would be the first steps you tell them as they're navigating that and they're immediately blaming themselves?
I, just that it's not their fault. Like I think there's no one there's no one cause, right? Like even, somebody who like I had a family who I've had a couple families with allergic reactions and then trauma around that, and then working, like consulting with a psychologist on how to rebuild engagement with food while they talk about the parents' anxiety about how they created that. And it's
Yeah.
such a fun marriage or such a fun uh, collegiate moment to help a
Yeah.
family like that, because I can be working with a kiddo, re-engaging with foods that were previously terrifying because of that one incident, which is massive, like
Yeah.
choking
Huge.
or having anaphylactic shock. Both, like it's life or death in that moment. And I think we all have, it's like a cliche, like it's in every movie, you have a life or death moment and your life
Yeah.
changes and shifts. And so
Yeah.
rebuilding that relationship with the people in your life around mealtime, the food, the environment. I can work on that, and the psychologists are working with the family to take that guilt and shame out of the equation because it was an accident. Nobody knows they're allergic to something until it is.
Well, you
So
are. Yeah.
yeah, you got to take that shame out. And there's so many people, so many of us as clinicians don't even know we're pushing shame. like on
Yeah.
accident, like even questions like, I mean, this gets more at culture, but like even questions about, well, how often do you guys eat at the table? It seems like a neutral question, but it's actually so loaded. And
Mm,
that question alone, like, gets a lot of like, I have worked with great families who, um, have shared when they've heard that question, the hairs on their neck go up because
yeah.
there's ideals in movies and then there's our daily stresses. And if you have a kiddo who has like another diagnosis on top of it and you're spending hours of your day going to different therapies, like what table?
Right.
So it's like important for us to kind of look at that and
Yeah. And also juggling when you're first getting a diagnosis too. I mean, that's something we've talked about in the podcast. It's like first steps that you can go through when you first get your autism diagnosis or a loved one has. And there's so many mixed messages you're getting about do
yeah.
this therapy, talk to this person, do this,
Yeah.
this, and this. Um, so let's say someone suspects some feeding issues or they're
Mhm.
noticing avoidance. They're seeing something that maybe is out of the norm for their child. What would you say the first step is?
It's the first step is, aside from putting any stress or ownership of that onto you, is to also look at, um gosh, nowadays I tell people go to Feeding Matters because it's such a wealth of information, right? And it can tell, and one of the things that these consensus papers, these two seminal articles that I'm going to give you to share, um, the first one talks about like what's a framework that we can look at for how to approach across all these disciplines, right? And the first one is to like, as behavior analysts, we always say we can't do anything behaviorally if medically we're compromised, right? And so like looking at any medical concerns, like are there allergies that haven't been addressed? If there's a history of that, are there, do you see other, like if there's vomiting and spitting involved, like let's look at the parameters of that. Like, is it a particular pattern? Could it be tied to allergies? Like looking at all those medical necessities first.
Right.
And then being honest, like this is something that's really made an impact working with other clinicians because I think as behavior analysts, we define behavior differently, right? Like we're not looking, when I say behaviors, I'm not talking about challenging behaviors,
Right.
right? So like I'm talking about a macro view of patterns and environments and conditions and how those yeah, like what is it like if you take like if you're doing lab works, like if you're having surgery, you can take a little blood sample and that'll
Right.
tell you a tiny piece of information, but no doctor says, okay, this blood work done, we're going to do this. They take it across your family history and your environment and all this other stuff.
To
And the
gather all
same
the
thing.
knowledge. Yeah.
Yeah, so it's like as a behavior analyst, I'm looking at the big picture more than I am the little picture, honestly.
Yeah.
And so I think, we want to look at the medical um any medical concerns first, and then also look at feeding skills because a
Mm.
lot of the quote unquote behavior challenges come from skills that aren't strong.
Mhm.
And we also don't have the expertise in a lot of those feeding skills. Like, I have a kiddo who wasn't eating, he just didn't prefer, he was just missing a nutritional category. And it turned out he didn't have the endurance to chew because he hadn't been eating those foods in a long time.
Mm.
And he was
Those are
paired
just
up
something
with
to think about either. Like that wouldn't be something that would initially go through my head where I'm like, oh, thinking about the endurance to choose something
Mhm, mhm.
would not be something that would initially come to my mind. That's a really interesting one.
Yeah, and I think it's like you would say, oh, they're not spending enough time at that table. Well, if I have a kiddo who like I've done the relationship building, like hey, this kiddo and this like everybody is having fun at the mealtime, right? Like there's
Yeah.
no reason to leave. We're all pumped. We're engaged with the food. We're nibbling the food. And if I have a kiddo that is pocketing and doing all this stuff, that's been something an education for me from the speech therapist and the occupational therapist to say okay, like a pocketing is not necessarily like an avoidance of food behavior. It's also a skill deficit in chewing and things like that. And so that's another thing I would say. Like, look at the medical concerns, look at feeding skills, feeding skills,
Eating both of them, eating.
feeding skills and
Yeah.
eating skills. Um, and that's where you connect. Like, I always say, like, have they had a speech of like a swallow study done? Like, um, like get those things hammered out first. And
Yeah.
then, and sometimes, like in that consensus paper, it talks about that framework, like go medical, go feeding skills, but also start where comfort is. So, like, a lot of
Ooh, I
times,
love that. Start where comfort is. Yeah.
yeah, because a lot of times my families don't have access to all those clinicians is variable,
Mhm.
right? Like different environments don't even have a BCBA who feels comfortable in that niche or a psychologist who feels comfortable in that niche. It's still really small.
Right.
So there's a lot of room for impact, BCBAs.
Yes.
But and nutritional too, right? So it's like look at those categories and if those are all going well, or if you've figured out which one is having a hard time, prioritize what skill development needs to happen. And then as a BCBA or anybody in the psychosocial domain,
Yeah.
look at how that interweaves. Because I have had a case where I knew something medical was happening,
Mm.
um, or feeding skill was happening, but the kiddo, um, because of another diagnosis, wasn't able to communicate that nor participate in the assessment of those.
Mm-hmm.
So I had to start working, build that engagement and comfort and participation up. And then once that was strong and that relationship was really strong, then we got to go back and do that allergy test and that swallow study. But he couldn't do that before.
Yeah.
So there's some gray, but first I would say for a family to look at medical feeding skills and then behavioral and psychosocial.
Yeah, those are great call outs. And I love to
Yeah.
the added resource, right, of checking out Feeding Matters to see,
Yeah.
where they can even start, where to go with that journey.
Mhm.
Um, well, kind of switching gears here. I know
Yeah.
a big theme we've kind of talked about here is interdisciplinary collaboration, right? Like
Yeah.
that's a huge piece of everything. A piece also of that is professional courtesy, right? And kind of looking at how to navigate that. What does professional courtesy look like in practice when multiple disciplines are involved in one child's care? Especially, I mean, this could be, your perspective, especially from a parental lens, from a clinician lens,
Yeah.
however you want to take it.
Yeah, I think again, starting from back from my little journey feels little. I guess it's 20 years.
Your little journey, just a little
I'm
guy.
like, golly,
Yeah.
I forget how old you are.
Yeah.
I'm 23 still in my head.
Hey, you're young.
But but I think I the clinics I worked in were all multidisciplinary. So I had a lot of practice and I got to see um how that working together benefited the family, and when to prioritize which clinician. And I think obviously there's been a massive learning curve. Like I'm a baby when it comes to Feeding Matters and that organization. I've been with them for 2 years now, and the council is almost a year, actually. Yeah, no, it's a year old now. Sorry, I was like, ah.
Aw.
So yeah,
Amazing.
but I'm still a baby, it's been there for 20 years. And so I've gotten to have a lot of practice, learning all the disciplines involved, which is a multitude. Like on our council, you know, there is everybody, all those disciplines I've alluded to, they're all there. And it's so cool to be a BCBA among all of those different fields and like how we advocate together for the education of pediatric feeding disorder and families being anchored in care.
Mhm.
And there's parents on the council. I think that's a big mission of Feeding Matters. And so when we think about, I think that helps us too, because sometimes I remember in the first few days or a few, like when we didn't have as many parents on the council, there were discussions of like, oh, I'm having a hard time with his parents, blah, 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 blah. And not of the parents, but just like helping the parents learn and advocate. Then we got to hear when the parents joined the board about how a lot of them have had to give up full-time jobs to feed and do every 2-hour tube feedings with their
Mhm.
kiddo. Like these are it it is
No small thing. It's their life
it,
altering decisions, is really what
life
they are.
life altering is like the most profound word because it truly is. And to hear like not only do they have, going from two incomes to one, which nowadays a lot of us need two incomes, three incomes. So it's
Yeah.
like we have to appreciate all that. And then the emotional toll, like you're talking about one family member to one caregiver, but there's other kids exist in families, right? And so,
Even
and
one to
then,
one is challenging, right? I mean, the
yeah,
burnout of
yeah,
being, your whole existence being the support for another person when you're also
yes,
trying to meet your own basic needs, right? Even if
yes,
that's your full-time job. That's a lot. That's a job and a half is really what that is.
absolutely. And I think that was, it's so important to make sure you have a voice of who you're anchored in, right? And so that
Mm,
family, and again, Feeding Matters, shout out to them always. They're really great at making sure we all can keep coming back. That was something we talked about in the Easter Seals mission. Like, why are we doing this? Why are we all sitting at this table for this kiddo, for this family? And that's the same thing. That's like, the continuing thread of all these organizations that have been so inspiring to work with, um, is the anchoring in that family moment. And so I think when the clinicians, um, I have teams of, I have one team I have has 7 clinicians involved in, the other one has 11. Like these are big teams that we're all collaborating on.
right.
And we all have different times. Like, um, I think most important is for us to realize the priority of what the family needs in that moment because it
Mm,
changes so drastically.
right.
Like one kiddo, not sharing exact details, right? But
Yeah.
but I thought it was so interesting to, I worked with the kiddo at first, right, to build that, rebuild that foundation of mealtime. Then, it's so engaged that now he can go into, now feeding therapy is a great perspective, right? And so the families, I'm hearing the family talk about, like, my perspective is caregiver training. So I'm hearing the family talk about how, oh my gosh, I'm going between 3 different cities in the
Yeah.
afternoon. Like I have a job I'm trying to maintain, trying to get these schedules, pulling him from these services to get him to another service. I'm overwhelmed. Like I'm
Yeah.
hearing all that. And what we can do as clinicians is go, um, with their blessing, of course, have a conversation about, hey, this the amount of therapy this kiddo is in, it all seems pivotal, but what specifically would have the most impact because the family's drowning and they A can't afford it and B can't afford it time-wise. So like which do we all think is the most impactful in this moment? And in that moment, it was feeding
Love
skills.
that. I
Yeah.
love that.
So we all
Well,
shifted,
but
which
what
was great.
if, I mean, this actually kind of ties in perfectly to my next question is
Yeah.
what if you guys don't agree? Because I mean,
Yeah.
we all have, like you said, there's unified goals. We're anchored in the
Hmm.
family. But of course, with
Yeah.
different disciplines, our priorities can sometimes be a little different. So what do you do when you have this whole team that's all focused on the child, but they all have different ideas of how something should be done? How would you navigate that?
I think the pre-work is important, and I don't even like saying work, because
Planning?
that takes away from the
Yeah.
relationship building, right? But like
Yeah.
just like you build a relationship with the family, you got to build a relationship with the team in general. So like getting to know the history that that kiddo has worked with that clinician, how the family ended there, why, what goals did they have, sharing those goals, sharing the progress, sharing the timeline, and I honestly. Sorry, I'm trying to like go back. I've only had 2 teams where even a bobble of a moment happened, and it was because we spent so much time getting to know each other before that bobble happened, right? So like I'm saying bobble, I don't know why, but like that little difference of opinion.
Yeah.
So like before we touched base on all that history with the family and the therapist and that progress, and it was really important. Like it's not disingenuine. I think because of our evidence base, sometimes we can do weird things like, the compliment sandwiches and stuff like that.
Yeah.
It's not that. It's
Yeah.
genuine relationship building, right?
Yeah.
Like under don't go in there like I'm a behavior analyst and I'm better than you. Like, what is your story? Oh, I see. Every time that kid comes from your session, I'm immediately after and he's glowing and he's bragging about all of his success with you. What was effective, right? Like
Yeah.
I don't typically bring token economies into the home because A, parents have a hard time with them because it's just one more system they're supposed to keep up with
Right.
and I'm
On
not
top of the
trying to
millions of
layer
other
on.
things. Yeah.
Yeah, like so but this kiddo, really wanted one, and he had a blast with his speech therapist using it, and it was really effective. Great. Okay. So we put it on the fridge and he loved it. And he loved telling all of us who interacted with him about it.
Yes, I love
That was some,
that.
right? Like that was something where it wasn't being used in a way I would use it, but how it was being used was helpful to this client, was
Yes.
reinforcing. He was very engaged with it, and let's go for it, right? And like it wasn't implemented by me as the behavior analyst, even though it's a strategy we use all the time, but that doesn't mean another discipline can't be using it and it be effective, and we can't celebrate that. So
Yeah.
celebrating that, so in the moment when we had to say, "Hey, I think skills wise, mom knows a lot of the feeding skills now. She knows how to engage him and rebuild any relationship repairs that need to happen. Now, can we send him to OT? Because, everybody's kind of saying the words that start to highlight OT's presence more.
Yeah. I
And
love
then it's
that.
like, okay, so those are kind of what we've done is just showing,
I love that.
highlighting that progress and showing that genuine,
Humility is really
yeah,
what it is. There's
yeah,
humility in it because,
yeah.
of course, we always think ABA is the best. And of course, our podcast too, we're like, ABA, just check it
Yeah,
out. It's
I
great.
love ABA. I'm
It's
here for
amazing.
it.
But you know what? Like,
Yeah.
when you're thinking about the hierarchy of priorities that make the most
Yeah.
meaningful impact, which again, we're looking for socially significant, meaningful impacts for our families,
Yeah.
might not be through ABA in the moment. But like you said, I love the perspective that you were talking about, where you're talking about starting off with what's the most needed in that moment.
Yeah.
Then you start noticing, oh, hey, we've prepared them for the next thing, right? Because
Yeah.
now we're noticing, signs for OT or speech, whatever. I think that's a beautiful perspective, especially when we're thinking about the overwhelmed parents' experience where they feel like this sense of urgency for everything to occur right now in this moment
Yeah.
where they're doing a poor job of supporting their child when that's not the reality. Sometimes and oftentimes, I think the disciplines build off of each other really beautifully
Yeah.
because
Yeah.
we lay a foundation of success, for them to build off of.
Yeah.
And that might be starting with ABA, that might not be. And so I think that that's such an unique and awesome way to frame it.
Well, and I think knowing the elephant in the room too, like there a lot of parents come to me and say, um, yeah, what was one parent said, okay, I keep getting pointed in your direction, but we don't do ABA. Okay. I am a BCBA, so I do
Yep, you're like,
ABA.
wait, yeah.
Yeah, yeah. But let me tell you why you might be ending up on my side and like what it looks like because it can look very different, right? And how I can collaborate with other disciplines. And, they also come in with my, this discipline said, you guys suck. You guys said this discipline sucks. I don't even know or care. I just want
Yeah,
my kid to have access. I can't
yeah,
access you. I need insurance. Like all these things that they're trying to muck through, if you will. And I just
yeah.
try to dissolve as much of that as possible for families. And again, I think the mission of Feeding Matters helps have that at the
Do that.
forefront for
They're
every
the bridge.
discussion.
I love that.
Yeah.
Well, and so kind of a related, not related question,
Hmm.
sort of. So when we're looking at the parents' perspective, right, they're trying to navigate the concerns that they're having.
Yeah.
How do they know who to bring it to, whether it's a BCBA versus another provider? How would you kind of give that advice to a parent?
Yeah. And actually, again, these two articles, gosh, they help with a lot of
You're
this.
like, just read them. We got it. We're good. Yeah.
No.
Come on, parents, read them.
No, and I hope I can do that work for you and I say that just because everything's so individualized, right? So like if
For sure.
if
Yes.
a kiddo comes to me because they vomit the minute a mealtime is introduced, then I'm gonna suggest again, going through medical first, feeding skills next, just making sure those two have been addressed so
Before
that there's
anything.
not, especially with the young kiddos, they can't articulate, a lot of them can't articulate why they're running away from a meal, right? Like it took um one of my kiddos, gosh, a few weeks of us just working on kind of like getting at what his specific frustration was um and it was just a lot of detective work. But for him, it was the the smell, but his mom
Mm,
couldn't she was like, it's not even, it's 2 rooms away. And it was just,
yeah.
he could smell it. And so
He knew
once
it
he
was
could
there.
figure
Yeah.
out, yeah, he could articulate that. That helped immensely because his mom would just, like on cell phone, it killed her at first, but sometimes it's
Yeah.
a flex point, right? But for hers,
Yeah.
she paused on the garlic because apparently for him it was not.
Yeah. He's like, tone
And
it down, lady. Yeah. Yeah.
yeah. Well, and we all have like some of us can smell garlic coming through pores
Oh my
10
gosh,
people
yes.
over.
It's interesting that like the
Yeah.
sensory sensitivities that different people have, right? Whether it's,
Yeah.
especially with smell, that's such a sensitive one, So that makes sense to me.
Well, and I think it's sad too because it's like that's where the listening and the observing and the pattern tracking comes into play because a lot of us don't experience mealtime like the other person. So we have
Um,
to believe, just because we can't observe it or see it, there is this, like we can observe the running away, we can observe that pattern, and then we can start to try to tie in that communication as best we
yeah,
can. But it's not like a black or white issue.
no,
Like I can't observe some of the things they're communicating, and sometimes they learn to communicate something from somebody that is actually not accurate of what they're feeling, and they kind of have to deconstruct that and rebuild it, right? So like
right.
that's a lot on families. That's a lot of detective
A
work.
lot, yeah.
Yeah, like how, and then there's things that medically we don't have a lot of understanding. There's a lot of like reflux challenges that I'm learning about from colleagues on the council that are like you can't see it.
Yeah.
It looks similar to other escapee, like
That
other
impacts
reasons
so
to,
many of my kids. So whatever,
yeah,
if you have any resources on that, I actually would genuinely love to learn more about that because
yeah,
I have so many kids that I've worked with who that's a specific thing and digestive difficulties. I mean, the comorbidities with digestion
yeah,
problems and tummy issues in general with
yes.
autism is so high. So, yeah, I definitely, that's
When
interesting.
Well, and it's funny because, like again, for the parents, and the reason I say that article is so helpful because that article has tons of visuals. So
Love
actually,
that.
you don't have to read it. You can look at these like
Yeah, love it. They made it into a little cartoon for all of us people that just
yes,
like to go quickly. I love it.
yes.
Yeah.
And I mean, again, why that Feeding Matters website is so nice because it takes throughout the website, like on the what are PFD and RFID slides, not slides, page.
Yeah.
They have those those
Love that.
infographics and that's the whole point. Like a parent shouldn't have to go learn how to do how to do research. It should be that simple for them to understand, and Feeding Matters does a great job simplifying it, even down to
Love that.
I was trying to see if I had the graphic nearby me to pull up, but
That would have been
even
cool. You just immediately
I
like
know I'm
me.
like
Yeah.
even down, like I'm gonna look at it. Even down to where, like those domains I talked about, like
Yes. The
medical,
coordinates.
nutritional, feeding skills, and psychosocial, they have a infographic that then has the disciplines married into that to reach out to.
Oh, that's
Yeah,
fantastic.
that's what I'm saying. Like these articles are great, not only because of, it's
No, that's
research that we all,
incredible. That's
yeah.
incredible resource for families who
Yes.
are trying to figure out where to start. And that's something
Mhm.
actually, we talked about, I forget what episode, but talking about how oftentimes the sciences that are designed to serve people are the least accessible to the people that they serve.
Yeah.
And
Yeah.
that's highly